This is Democracy Now!, democracynow.org. We're broadcasting from the epicenter of the pandemic in the United States, New York City. I'm Amy Goodman, but we're turning now to look at the coronavirus pandemic in Asia. In the Philippines, authoritarian President Rodrigo Duterte said Wednesday he's ordered soldiers to shoot to kill residents if they resist a strict lockdown on the island of Luzon. His order came after residents of Manila's Quezon City shantytown staged a protest saying they've gone hungry without food promised when the lockdown began more than 2 weeks ago. The Philippines' death toll is 136, with more than 3,000 confirmed COVID-19 cases. As those numbers grow, nurses and doctors report drastic lack of personal protective equipment. 17 frontline medical workers have died. This week, Democracy Now! Spoke with ER nurse Ara Santos Serrano, who works in a hospital near Manila.
The situation right now is a little bit difficult because of the surge of patients that we are having right now in our country, in the Philippines. I'm working in a level 1 hospital, so we usually do not cater ICU type of patients, but since of the surge, we are obliged to at least treat emergency cases for patients who are showing symptoms of COVID-19. The one consideration is the PPEs. We need to have them, but of course, since there is only a limited number of supplies provided for us, it is really difficult to attend patients. Our current situation right now, it's like in my department, they're allotting 1 PPE for 1 COVID nurse. So that's difficult because if a patient will come with a very critical condition, it is hard for 1 nurse only to attend to that patient. With the scarcity, it's like I've been told earlier, I had a meeting with my bosses, and it's like our stock of PPEs and N95 masks would last for like 3 to 4 days. Our enhanced community quarantine will still be 2 more weeks to run, and we are still expecting the cases to rise up. It's really sad because there are doctors who are dying right now in my country.
While the Philippines has seen a surge in cases, Indonesia is now reporting the second most fatalities in Asia after China, with 181 dead. Nearly as many have died in South Korea, which saw an early surge in cases but has been widely praised for its efforts to flatten the curve. Singapore, Hong Kong and Taiwan have also had some success in containing the virus. Later in the broadcast, we'll talk about Taiwan. But for right now, we're going to Singapore, where we're joined by Natasha Gutierrez, editor-in-chief of Vice Asia. Welcome to Democracy Now!, Natasha. Thank you for joining us. Can you start off by talking about the situation in the Philippines?
Yes, absolutely. So, it's just heartbreaking to hear that account of that nurse, because it's exactly true. We're hearing frontliners not even being protected. And so there's questions on how can doctors curb this virus if they themselves are in danger? And, in the Philippines, we're talking a country of 100 million people. March 16, we saw a lockdown in the island of Luzon. That's 57 million people. And that was only just the 3rd country after Italy and China to have had such extreme measures put in place. And President Rodrigo Duterte at that time had declared a state of emergency for 6 months. Note that this is the longest state of emergency any leader has declared. And so now it's still that way. People can only go out for essentials, meaning just food and groceries once a week. But I think what made many nervous and continue to make people nervous are the wide deployment of military and police on the streets. There's a curfew in the Philippines. People are unable to leave their house between 8 p.m. to 5 a.m. The president has also asked for emergency powers to reallocate funds of 200 billion pesos. That's about $4 billion to help the poor. But as mentioned earlier in the program, there are riots because it's not clear where this money will go. There has not been any clear plan from the government. And so I would say that currently the overall general sentiment in the Philippines has been one of disappointment and confusion over the government's actions. Many people are asking for clarity regarding the government's plan.
And can you talk more about Duterte, who's known about boasting about raping people to personally murdering people, using this moment of the pandemic to expand his authoritarian powers?
That's exactly right. There's a lot of concern over President Duterte's actions. It's not a secret that he is someone who has authoritarian tendencies. He has declared a deadly, brutal war against drugs. And this has actually targeted mostly the urban poor. And sadly, we're seeing the same with the pandemic. We're seeing that the people who are getting arrested are the poorest of the poor. We've had politicians, senators break their stay-at-home notices, their quarantine. One even going so far as entering a hospital and putting frontliners at risk. And yet he has not been arrested, has not been apprehended, and the Department of Justice said that we should treat him with compassion. Meanwhile, we're seeing people breaking quarantine who are being put in dog cages. We're seeing arrests of homeless people. So again, the ones who are really suffering in this sort of militaristic operation are the poorest of the poor. And of course, again, as mentioned earlier, his requests for emergency powers, again, it's just making people quite nervous because that's just added powers. And yet the Filipino people are not seeing any major differences or any confidence, I guess, in the government to see that they're actually using the funds properly.
These comments that Duterte made, shoot them dead. I will not hesitate. My orders are to the police, to the military, also with the village officials. If there are troubles or occasions where there's violence and your lives are in danger, shoot them dead, he said.
Yes, he said this 2 days ago, and this is very reminiscent of the way he also directed police to kill people who are using drugs. And the scary part is, as soon as he did say that, from the beginning of his term in 2016, we then suddenly saw a lot of killings. So we're hoping that that is not the case, that the officials and authorities will understand how difficult this pandemic is for some informal settlers, people who can't even have the luxury of practicing social distancing measures, and just treating them with justice, hopefully. But it's what makes a lot of people nervous because we've seen it in the past happen, specifically with the drug war. Compare
what's happening in the Philippines to Indonesia, as well as where you are in Singapore.
In Singapore, I think the number one thing that the government has done from the get-go is clear communication. Obviously, it's a small country, unlike the Philippines, unlike Indonesia. It has 5 million people. It has a fairly cohesive government and very strong medical resources. But, from the get-go, they implemented what every outbreak response should be. That's early case detection, aggressive and thorough contact tracing, and isolation or strict quarantine. It was very quick to act. As the situation evolved, when we saw more imported cases, they gradually closed borders. Just this afternoon, just 4 hours ago, Prime Minister Lee Hsien Loong also announced more extreme social distancing measures, which is essentially a partial lockdown starting on Tuesday. That's after we saw an increase in the number of local transmissions. So we're seeing a government that is nimble, that is adjusting, that is clear in their communication. What's been consistent throughout is constant reassurance through not just the words of this government, but as well as economic stimulus plans and consistent messaging on things as simple as food will not run out. They've clearly explained their policies, which is such a drastic difference from what's happening in the Philippines. And residents are quite happy with the response of the government here. As for Indonesia, that is the 4th largest population in the world. We're talking 200 million people. And I think what happened with Indonesia was that when a lot of the other countries started declaring states of emergency or perhaps announcing their first cases, Indonesia was very much in a state of limbo, announcing that it was business as usual. Bali was open to tourists, and it made people quite nervous because how can a country that big, an island of 17,000 people, possibly not have a single case? And most people assumed that it was because they were not mass testing. And only, I think, about 2 days ago, or even just yesterday, did President Joko Widodo declare a state of emergency. But until now, Jakarta and major cities remain not on lockdown. There is no national lockdown, despite the fact that its mortality rate is now at 9.4% for COVID-19.
Natasha Gutierrez, I want to thank you so much for being with us, Editor-in-Chief of Vice Asia.